So for the test sites, we need to choose the test sites. And we have, for everyone, we will be testing on the right cheek. And the place that we want to test is already marked on our diagram. The place that we want to test is in the middle of the pupil. We'll line it up at the middle of the pupil and the bottom of the nose. So we'll put a little dot on the person's cheek when we're ready to get ready to start testing on the test sites. So you can use a highlighter is usually what I use, so because it's fairly easy to take off. So just put a little dot, little circle on the person's cheek in this spot for the first test site. And then the second test site is going to be in the most painful area within the dermatomes that are 1 to 3 levels below the neurological level of injury. So once you've determined where on the person's body sensation starts to change, you can go from that dermatome and 2 dermatomes below that. If the person has already reported that they have a pain condition or pain symptoms in those areas, in those 3 dermatomes, then you'll want to choose the area. Ask them, what seems to be the most painful area? And then you'll choose to test in that area. If there are no painful areas, then you want to go to the first dermatome on the right side below the neurological level of injury and choose the Asia sensory testing. Choose the Asia sensory testing site in that dermatome. So that's why you want to have your sensory testing sites reference paper there so that you can locate those sites. And then you'll want to put a dot on the person's body where you will be testing for site number 2. And then for site number 3, everyone will be tested on the right medial calf. And the way we do this is we use our measuring tape that we have with us, and we measure from its protuberance on the medial side of the knee, and between that bump on the medial side of the knee that you can feel, the bony bump on the medial side of the knee, to the ankle, the bone of the ankle that you can feel. You measure between those 2 points and halfway between, and that ends up being on a sort of meaty part of the calf there on the L4, within the L4 dermatome. And then test site number 4 is if there is a painful site, if site number 3 on the right medial calf is not a painful site, but there is a painful site that is at least 4 dermatomes below the neurological level of injury, then we will choose to test in a painful site below at least 4 dermatomes below the neurological level of injury. So that is, we would choose that site to be site number 4. And you want to mark these sites on the body. So you would use a pencil to mark where site number 2 is and label it as number 2. You might want to describe the location. You want to put the dermatome where it is located and describe the location. You may have said, oh, it's 4 inches lateral to the belly button in the T10 dermatome. That's where I tested. So you want to write a description that will help you get back to that site the next time the person comes in for a visit where we're doing the bedside testing. So you can record the dermatome where it is, each of the sites are, and you can write a name so you can remember what the site is. You may also want to take a picture of the person's, of the area of the site, of the test site, if you're allowed to by your IRB, so that you'll have that as a reference for when the person comes in for their next visit, their 12-month follow-up visit. So you'll be able to try to test in the same spot as closely as possible. Then, once we choose the test sites, when we've written them down here, we might want to take pictures, as I've said, of the test spots. You might want to make a measurement. If you're not going to take pictures, and even if you do take pictures, you might want to make a measurement with the tape measure and record notes. You definitely want to record where the site is, particularly obviously for site number 2 and site number 4, because we've predefined where site number 1 and site number 3 are going to be. Once you've chosen those sites, this column should be filled in. This is this site in a painful or a non-painful area where they said they usually have pain. So you will put a P for a painful site, an NP for a non-painful site. Then you will record the pain intensity at that site at the moment. So do you have any, you point to the cheek and you say, do you have any pain in this area right now? Yes or no? Yes, I do. On a scale from 0 to 100, where 0 is no pain and 100 is the most intense pain imaginable, what is the pain intensity at that site right now? So then you'll record those ratings for each of the test sites. Then you'll record the surface temperature. So very simply, you just put the thermometer against the skin, hold it for a second, and then it will give you the temperature reading. Okay, and you record that in degrees Celsius at each of the test sites.